My name is Ethan Wells. This is my med check video. So first we're going to be checking the provider's orders against the MAR to make sure that the medications are correct. The first medication we're going to be administering is Protonix 40 milligrams orally once a day at 1400. And then the second one, or that's correct, the second one we're going to be doing is heparin 5,000 units subcutaneously twice a day, but this one's going to be at 1400. That's correct. And then the third one we're going to be doing is ceftriaxone 1,000 milligrams intramuscular once a day at 1400. So those are all correct. So we're going to go in the room, provide privacy, wash my hands, put on gloves, then introduce myself. Hi, Ms. Bernadette. My name is Ethan. I'm going to be your nurse today from 7 a.m. to 7 p.m. We're going to be administering 3 medications, and this will only take me about 15 minutes. If you have any questions or anything, just let me know. So the first medication that I'm going to be doing is Protonix 40 milligrams orally once a day at 1400, and this is going to be used for indigestion, and we're going to be looking for elevated serum gastrin or GI upset, and we're going to make sure that we administer this on an empty stomach at least 30 to 60 minutes before first meal. So I'm going to get my medication, I'm going to scan the medication, and I'm going to scan Miss Bernadette's barcode on her bracelet. I'm going to have her state her name and date of birth. Once she's done that, I'm going to give her a glass of water and her medication. Once she's taken that, I'll offer her another glass of water, and then I will take my gloves off, wash my hands, put on more gloves, and then prepare my next medication, which is going to be heparin 5,000 units subcutaneously twice a day, but this one is going to be at 1400, and this one is going to be an anticoagulant for preventing blood clotting. So what we're going to be looking for is bleeding or any excess bleeding, and we're going to be monitoring platelets and monitor for bleeding and bruising. So once I've done that, we will scan our medication, and then scan Miss Bernadette's barcode on her wrist, and have her say her name and date of birth, so we know that we're doing the right medication and right patient. Going to prepare. We're doing 5,000 units, so pull 5,000. I'm gonna clean the medication with an alcohol swab and also clean the area on the stomach where we're gonna be doing the injection. So I'm going to pull our 5,000 units. Once we've done that, I'm going to recap our needle. Make sure there's no air bubbles. Alright, and then I'm going to alcohol swab again. We've already scanned our barcode on the medication and her bracelet, so we're then going to administer the medication. Alright, Miss Bernadette, I'm going to do your thing, and we'll do this in 3, 2, 1. We're going to administer that. Once we've done that, we're going to cap our medication, put that in the sharps container, and then put gauze on it, hold it for a second, and then once we've done that, ask if she wants a Band-Aid. There's no bleeding, so she says no. And then I'm going to take my gloves off, wash my hands, put on other gloves, and then prepare our next medication, which is ceftriaxone 1,000 milligrams intramuscular once a day at 1400. This is a antibiotic for UTI, They're going to be looking for adverse actions like rash and nausea. And then we're going to assess pain, monitor liver function, and make sure that we're doing this in a deep and developed muscle. And then we're going to get our things prepared. Go ahead and scan our barcode on our medication. Scan the barcode on Miss Bernadette's bracelet. Have her state her name and date of birth. Once she's done that, then we will pull 1,000 milligrams. Make sure we clean our medication and clean the area. And also we're going to find the greater trochanter and the iliac crest and find the middle, so I'll do that after I pull my medication. Alright. Go ahead and recap my medication. Alright. Just gonna set this over here. Find the greater trochanter, the iliac crest, find the middle, make sure that's good. So then we'll go ahead and alcohol swab it again, and leave the corner of the alcohol swab by the injection site. And then we'll go ahead and grab our medication again. We've already scanned the barcode on the medication and Miss Bernadette's wrist. We've had her set her name and date of birth, so I'm then going to administer the medication. All right, I'm gonna do it on 3, 2, 1. All right, once we've done that, we'll recap our needle. Put that in the sharps, and then we'll take our gauze, place that on the injection site, hold it for a second, ask her if she wants a Band-Aid. There's no bleeding, so she says no. And then I'm going to take my gloves off, wash my hands, and say thank you.